A new standard for psychological health and safety in the workplace has been developed by the Canadian Standards Association, now known as CSA Group. The standard, considered to be the first of its kind in Canada, is scheduled to be released in November 2012, and it will be offered free of charge for the first 5 years. Canadian HR reporter sat down with Elizabeth Rankin, a CSA Group project manager, at the Canadian Society of Safety Engineering Professional Development Conference to talk about the new standard. So why a new standard for psychological health and safety?
Well, there's been a long history behind this, and there's been a call basically from stakeholders that have said that there's issues in the workplace that could be within the control of the employer to help prevent psychological harm to workers, as well as provide supports to workers who are in need.
What does the standard include?
The standard is focused on prevention, so identifying those things in the workplace that could lead to psychological harm and putting controls in, so either eliminating those things that could lead to that harm or recognizing that there is risk associated with them and putting whatever controls in place are needed. So this may include things like training for supervisors. It could be interpersonal training. It could be putting policies and procedures in place for dealing with events. It could have to deal with, how do you support a worker who is in need? Could be accommodation. It could be looking at, if an organization has to do a downsizing, how do we do it in a humane way that respects people.
Is the standard mandatory?
Well, standards, when they're developed, generally are developed as for voluntary implementation. They're not law, but they can be referenced in law, or they can be adopted into regulations. So if they're referenced or adopted, then they actually become mandatory because they are then part of the law. Now, we have no ability to tell regulators what to reference or what not to reference, but the standard is developed with the intent of being voluntary. It is the standard is best practice.
You've said there's a good business case for the standard. What is it?
We're spending already about $51 billion annually as Canadians on these on issues that are related to mental health. And about 20 billion of that is workplace related. The workplace related issues are things related to things like absenteeism, low productivity, presenteeism, which is kind of being, you're physically there at work, but you're not mentally there at work because your mind is elsewhere dealing with other issues. Some of the cost, of course, some organizations have EAP programs, so they send people to those programs to deal with some of the issues that they're dealing with, so that's also part of the costs as well. The other part is the legal part of the business case, whereby there's been an increase that we've seen over the past 5 years, an increase of 700% in cases like arbitration cases that are being, awards that are being given to plaintiffs, claimants for psychological health and safety issues in the workplace.